Welcome everyone to today's panel discussion on how NJIT supports student success through mental health. My name is Kelly Carlton. I'll be the moderator today. I am the VP of Partner Success at Mantra Health. I've been at Mantra for a little over 4 years now and have worked with every single one of our higher ed partners on their implementation, and my team also manages the relationships with each of our active partners to make sure that we can get these programs to be as successful as possible. So first, before we dive in, let's go through a few housekeeping things. So this discussion will last for about 30 to 40 minutes, and then we'll have 15 minutes at the end for Q&A. So everyone on the call, please feel free to use the chat function like you're doing now to speak to each other if you want. But if you could use the Q&A function at the bottom, that's a different button for any questions that you will have, because that is what we'll look at the end of the presentation to address all of those questions. And if you can't attend this full session, that's totally fine. We will be following up to send the recording to everyone. And then lastly, there will be a pop-up survey at the end of the Zoom where you can give feedback from the session, or you can also let us know what future webinar content you may want to listen to or see, or if you even want someone from Mantra Health to reach out to you for more information, that's another place that you can let us know. So with that, let's kick it off with some introductions. We have our partners from NJIT here on the call. If you could just give your name and title, and Mary Beth, we'll start with you.
Sure thing. Thank you, Kelly. My name is Mary Beth Bolger, and I'm the Vice President for Student Affairs and Dean of Students here at NJIT.
Sean, do you want to go next?
Sure. Hi, everybody. Good afternoon, good morning, depending on where you're coming from in the States. I'm Sean Dowd, Senior Associate Dean of Students, working with Mary Beth, and I'm responsible for our care team or our BIT team, depending upon what you might call it at your institution.
Great. And then Phyllis.
Hi, everyone. Welcome. I'm Dr. Phyllis Bowling, and I'm the Director of the Center for Counseling and Psychological Services, or CCAPS, at NJIT.
Okay. So first, I just want to set the scene for what we're going to be talking about today. We'll be talking about some real-life considerations for cultivating successful digital mental health platforms in order to help improve student success overall. So throughout the call today, you're going to hear our panelists here talk about the different models that Mantra Health offers. So I just thought it would be helpful for us to ground ourselves in what those models are, to give some context when we talk about that later. So what you see on the screen here is what we call our whole campus care model. And this provides campuses with a comprehensive end-to-end mental health offering, with services falling into 3 main categories, as you can see here: promotion, prevention, and intervention. So the aim here is really to give a range of services that may meet students where they're at along this care continuum. If you go to the next slide, Haley, we also have what we call our capacity expansion model, which is a little different. So this offers just the clinical portion of the model. So you can partner with us for therapy or psychiatry. And this is really for campuses who may not need that full spectrum of care, but can still benefit from having complementary services to manage clinical demand as things may get a little tight on campus, particularly peak semester, or any kinds of specialty care needs. Okay, and with both of those options, students get access to our dedicated provider group that is managed by our clinic. You also will have the ability to collaborate with those providers through something that we call our Mantra Collaboration Portal. So, at the core, both of these models are really grounded in transparency, collaboration, and really seamlessly integrating, our work into what you're already doing on campus, which is really kind of a nice segue into the conversation today about how do we actually do that then? So why don't we start very high level, and Mary Beth, I'll kick this one to you. Can you just set the stage for us? Tell us a little bit about NJIT, demographics of your students, and really anything that makes your campus unique.
Sure thing. So NJIT, it's a public university. We're a public university located in Newark, New Jersey. And we are a little under 13,000 students, undergraduate and graduate. And I would say we're well known for the research opportunities that we provide students, Obviously the fields of science, technology, and engineering. But what many don't know, we also have degrees in architecture, and we have a very robust school of management. And we definitely take pride in our diverse student body, and we foster innovation and entrepreneurship and research. And we also provide students an opportunity to engage with companies and industries to really get that industrial feel for what they're doing. The thing that makes us really unique, in my opinion, is the way that and this is part of the topic today, is the way in which we adopt a holistic approach to the way we prepare our students, where we emphasize not only the academic and technical skills, but we also prioritize the mental well-being of all of our students. We want to make sure our students are emotionally ready, mentally ready to handle the challenges of their professional journeys. So we're not just about talking the talk, but we actually walk the walk, and understanding that the success of our students is built on a foundation of both their professional expertise and also their personal well-being.
Okay, thank you for that. I think that actually makes me go to this next question for you, Phyllis. Given that is kind of the philosophy of NJIT, really trying to think about how we can give the students the resources that they need in order to succeed in school and thrive. Can you tell me a little bit about what the services look like on the ground, and how you think about that holistic approach? Oh, you're muted.
Sorry about that. Absolutely. You know, as Mary Beth mentioned, we really do try to look at the whole student and the whole community. So in CCAPS, I like to think about a sort of levels of care of community, and a sort of community public health kind of model. So we think about students who are healthy, you know, sort of just kind of, and keeping them healthy in terms of that model. Then you might think about students who are at risk, and you're thinking about prevention kind of activities, and maybe more sort of group or workshops and those kind of activities. And then you may also think about the students who are actually diagnosed with some sort of disorder, mental health disorder, where we're looking at effective and efficient clinical care. So at CCAPS, we really have 4 pillars that we think about when we talk about our services. One is clinical services, group counseling, individual counseling, that more what we do in person as well as virtual at CCAPS. And groups. We have a number of groups that are working. And then we also think about consultation and collaboration. We consult a lot with our colleagues. We collaborate with the prevention folks to do workshops, to do tabling, to sort of do outreach to students. And outreach is sort of brought into that too, outreach and prevention, and then training and education, training RAs, training other peer helpers, working with faculty and staff. And our CCAP services, we have 6 positions within CCAPS that are that are staffed by doctoral and master's level licensed professionals. We also have a model now that we started working with, where we have what we call embedded or liaison clinicians. So there's a clinician that works specifically with international students and graduate students, and another clinician who will be working with our EOP population beginning in March. And we also, you know, provide a number of workshops and that sort of thing as well.
Amazing. So really robust services that, you know, already exist and are kind of homegrown at NJIT. So, you know, given we do have the whole campus care model that we've launched at NJIT's campus, can you tell me a little bit about, given, you know, you do have quite comprehensive services already, can you tell me a little bit about when you first started thinking about how to, you know, looking to a telehealth vendor to fill in some of the gaps that may exist despite having all of those services on the ground? What did that process look like? What were those gaps, and how did you think about that?
I don't know if you want to start him. Well, I can start, or
Sure.
Yeah.
I think we can both take this one. I think for me, I'll just set the tone that, you know, at a STEM university, it's a really rigorous academic program for our students. And so one thing is to think about how to make these services more accessible and convenient for students who are in this demanding environment, and some students who prefer like a more flexible remote situation to meet their needs would be one area. The other area, I think that the importance is to look at ways in which we can address the needs, providing students more access to these needs, right? To their needs. I hate to bring up COVID again, but we know that during COVID, mental health issues skyrocketed, and people are not just students, but people in general were looking for help in so many different ways. So one of the reasons why we're looking to fill this gap in different ways is really to try to meet our students where they're at. I know, Phyllis, you want to add a little bit more?
Yeah, I think we first started really thinking about this towards the beginning of the pandemic, actually, because of, thinking about the mental health needs of students and how much they increased and wanting to increase capacity. And again, as Dr. Berger said, meet students where they're at. There's some students who are, coming to a counseling center, thinking about going to a counseling center is very stigmatizing. So that sort of helps meeting students where they're at as well. We also have a large commuter population at NJIT. So virtual services, might be more convenient for students in terms of meeting them where they're at for that commuter population. And again, the schedules, as we mentioned, and the just increasing capacity. Our staff is not that large, so we wanted to also increase capacity.
Got it. So it's kind of trying to reach those students who either like don't want to or cannot come into the counseling center, because you have a lot of resources that, again, like thinking about those different levels of care, like you already have that in place in a way, but there's, there are so many, only so many of you. And it sounds like you kind of like, whenever you were looking for a vendor, you were hoping to reach your entire population potentially, and really particularly those students who may not be able to come into the counseling center and access those services, because everyone has different situations that may prevent that.
Yeah, and I guess what was fortunate in terms of COVID is that students were accustomed to virtual and became very accustomed to virtual. So it kind of fit right in during that time frame as well.
Yeah, part of our day-to-day now.
Yeah.
How many Zoom calls have I had today? Okay, so at this point, you knew you wanted a vendor, you knew what problems you were trying to solve. And we also know that, it's an incredibly saturated market, and there are plenty of different vendors out there that you can choose from. How do you think about choosing the right vendor for NJIT? Can you walk us through those steps you took, or your thinking process? Because I think that that's something that, people can potentially get value from, given there really are so many of us out there now, and you want to make sure that the vendor is truly solving the problem that you need them to solve.
So I'm just going to jump in and say that really I have to credit Dr. Bowling for leading us through this process. The important thing for me was that it was a partnership, because it was important that we be able to work closely with the vendor to ensure that we're hitting the mark with our students. So it was important to become a true partner with that vendor. But I'm going to turn it over to Dr. Bowling on this one, because she really led that process for seeking out the right vendor.
Yeah, I have to say that it is very true that there are many, many vendors, because I spoke to many, many, many vendors and looked at lots of PowerPoint presentations for different types of services. But the thinking about the responsiveness of the vendor, I think, is one of the really critical issues. How accessible are they? How much are they sort of thinking about meeting the needs of the university and individualizing as much as possible on meeting those needs, responding to questions, responding to concerns. That responsiveness is really, really critical. And then integrating seamlessly as much as possible, so that the services can kind of just be blended, and the students can know that this is part of NJIT in some ways. So integrating seamlessly. And then I don't know, Sean wants to jump in a little bit about the marketing. So also vendors who can support marketing to get the word out about the services and what's available. Were also really critical issues.
Thanks, Phyllis. I think all makes a lot of sense. Do you have any anecdotes and it's okay if you can't think of them right now, but I'm trying to bring this to life a little bit of like how this integrating seamlessly, like what does that look like? What are some versions of that you've seen work, like really play out well between how, people on the ground and maybe like the tools that are available, how you collaborate together, how you kind of seamlessly integrate in that way?
One example that comes to my mind just off the top of my head is that we have in some of the tabling events that we've had, we've presented CCAP services as well as the services of Mantra at just sort of side by side, hand in hand. That was one way, and fortunately, we have some Mantra folks who are close by to where we're located, so they can actually come on campus. And be introduced to the students and get to know our students sort of in almost in person. So that was another way of the integrations, the seamless integration. I don't know if Sean, you can think of any others. In terms of working with the clinical staff here at CCAPS, Mantra was really very, very open to getting our feedback, our concerns about who are we referring our students to. So we got a chance to actually know about the therapist who are going to be seeing our students from Mantra. And we also had an opportunity to meet with the person who developed some of the modules and talk to them about those modules and how they might be integrated into the work that we're doing in CCAPS. So those are all some of the seamless integration things I can think of.
That's great.
And
Thank you.
I would certainly say from the lens of the care team or a BIT team is that on a daily basis, we're referring students to CCAPS. But what's been great now is that we just add on another layer because even those students who are actively using CCAPS and who are very, very happy with the clinicians, Mantra's platform has complementary services that they can engage in, either, I would imagine, referred to by CCAPS clinicians or through any of us who know the platform to say you can kind of get even more support either on your own or passively, which some students really appreciate. I've talked with at least a couple of students who have used those modules, have gotten some level of comfort in navigating them. And that's led to them saying, well, this has been a good experience. I'm going to challenge myself now to make that phone call and actually have an in-person or a virtual encounter with CCAPS. And so it's another way just to be able to roll out to any faculty member, any student. Here's a counseling center and their wellness groups, the myriad of services they have. Here's another option. And there's no additional fees, and the access to it is using your NJIT credentials. So it's not as if they have to do some Herculean tasks. It's pretty streamlined.
Okay. So yeah, making it as accessible as possible and really meeting the variety of needs that may show up in your population. Okay, so thank you for all of that. So you chose a vendor, you went through that whole process, decision-making process. Now what? So Sean, I'll kick this to you because you're my implementation buddy. I want to start high level first. What do you think are the three most important things that a campus should be thinking about when they're implementing a new vendor on campus? So a little bit different from choosing a vendor. Now we're getting like kind of more tactical about how you actually do that.
Right. So I've served at several institutions, some public, some private, some faith-based, some not. And I know that each university has their own kind of model and structure. Some universities may have a well-established group that you say, I want to embed this model, and then they kind of roll it out and you're the beneficiary of it as well as the students. And then there's our campus who doesn't necessarily have that. And it requires us to be able to identify those campus partners that are going to be able to help us with the rollout, but also the maintenance of that program. So I would first say, just to identify who that group is going to be. I think, and I'll speak for myself, that the process with Mantra has been really, really convenient because we're not alone. So I remember the first kickoff meeting, Dr. Bulling and I were there, I think Dr. Boger as well. And here we have Mantra saying, here's the framework for that. Here's where step one is. And if you're unaware of what that rollout looks like, here are those people that you really need to connect with for the basics. And so even if you're feeling concerned about what those steps would be, there's guidance, but you still need to know who are those campus partners to help actualize this. So that could be your tech group for the single sign-on. That could be the branding, because for our institution, like many, you can't just slap Mantra onto something. It has to go through trademark and licensing, and they want to make sure that we're doing that right. And so those people have been really helpful. So I would say identify the campus partners. And if you don't have those relationships, just try to seek those out through senior administration and carve out those conversations. The second I would say is timing matters. And I know probably later on we'll talk about the what ifs or what it could you do something differently. But for us, we ended up having a later rollout. So we didn't have the same opportunities in summer, for example, to really hit those critical touch points to expose the university community to mantra, such as new student orientation and family orientation, transfer student, international student orientation. Phyllis had talked about RA training. So the resident assistants with residence life, meeting with research assistants and teaching assistants. We're an R1 research institution. So there's faculty workshops, retreats. There's a number of things that we did, but it just took us a little bit longer and kind of out of step a little bit. So I would say timing matters at the same time. And then we have had conversations. I know, Kelly, you've talked about this a lot, and we have done this internally about we need to at some time, if we want to continue this platform and its use, we need to demonstrate its effectiveness and its return on investment so that we could sustain this great opportunity. So from the start, what mechanisms can you create that will gather data, gather anecdotal information, whatever it may be, so that we could say to Dr. Boger, here's all these wonderful things that it's doing. Please use your influence and your capital to help advance this so we can get money to keep this program here. So I would say, identify your team, whoever they may be, get to know them, because you'll work with them on and off. Figure out your timing and your schedule when it makes most sense, or if it's not able to do it in the summer, just plan ahead. And then what can you gather in terms of data and things so that you could ask for funding to continue this process.
Amazing. And I think that last one that you mentioned is not always thought of as what should be part of the foundation that you build. Sometimes it's like, okay, let's launch this thing. Like, let's just get it to go live. And then we'll, think about how to measure outcomes or even what those outcomes even are. But, our work together has really been like, let's figure out what those outcomes are. And then let's work backwards from there so that we can build a foundation that really ladders up to them.
Right. And I would say some institutions may benefit by winning a grant, and that grant is going to require, as we know very, very well on a very regular basis, you have to showcase what you're doing, how you're doing it, and what impact that's having. And so that's been helpful, even to say to Mantra, can you give me a quick updated stats so I could plug that in there? And even I appreciate that Mantra said, I know that you have to do a grant. Can you give me some of those questions that you're going to be asked? We're happy to help populate some of that information, and that's gold. So.
Something else you mentioned, Sean, and I'm curious to hear from all of you on this one. You talked a lot about like all the different stakeholders on campus and how this kind of is a campus-wide effort and to some extent for implementation, because like you mentioned, we do need someone in IT to check off that SSO box and make that go live. But I think there's also a continued effort on campus of like really making sure that this type of program does really infiltrate and get to the right corners in campus where students show up and where their needs show up. So given we know like achieving student success really is a responsibility for people across the whole campus, and when there's that cross-departmental buy-in and support, how do you think about, I know you said identifying those key people, but how do you actually think about doing that? And then how do you think about even more so bringing them into the fold once you do identify them and really create that sense of shared responsibility?
Yeah. I think just for my own beliefs, this is kind of the I statement. I feel very strongly that although it's building, it's very much a us and a we, not an I and a me. So I feel very strongly that when I've had to connect, or with Dr. Bowling and I have had to connect with the stakeholders, whether it's the IT folk, whether it's strategic marketing, whether it's the VP for athletics, whether it's Residence Live, whether it's our educational opportunity program or fund, depending upon your program, there are major constituency groups that have been very interested and willing, because so often they're meeting with students and they're hearing from those students that they're experiencing different issues, whether it's anxiety, depression, isolation, et cetera. And so they have an invested interest to be able to refer students appropriately. And I find that for a lot of our faculty who are very kind, they're content experts. And for many, they get a little twitchy when a student starts to be very, very emotional in their presence. And so giving them a referral and something that they can say to students, here's something that we know could be very helpful for you, I think has helped them be invested. But we have, I think, Dr. Boger, Dr. Bowling and I have really good relationships with the university community. We've been around for a little bit of time. And so we've been able to reach out to them to say, we need your assistance with this, but here's potentially the return on you. So for example, Residence Life, having the resident assistants learn through Mantra, through an information session during one of their in-services, help them understand what the service is and even how to refer students. It's not always easy to say to a student, I'm concerned about you, or I think that this might be of benefit to you. So that was very helpful. Athletics got the same thing where they created I think Mantra created a one sheet and some language that was specifically fine-tuned to student athletes and their individualized needs. And once you gave those pieces of resource to those entities, they were very much thank you, because it's helping not only students, but their objectives as well within their own departments. So I think it's just trying to find that hook, but we've seen some great support throughout the university community.
Absolutely love that. I think that, oh, sorry, go
Yeah,
ahead,
we've
Phil.
seen support to the extent that sometimes now they're asking for us to come in and talk about, the variety of resources. So just last week, I did a presentation and talked about Mantra with the academic advisors at their sort of training for next year, getting ready for the class that's coming in next year. So it's an ongoing kind of relationship that we're having with our collaborators and different campus constituents.
Yeah, love that.
And
Anything to add?
I would just add one more thing, is that when you have a culture of care on the campus, that helps to drive these initiatives in a lot more positive ways. So we have our initial collaborators, but we continue to grow with folks that want to collaborate with us, because we really do have a culture of care on our campus and for the well-being of our students.
That's great. I think like what all of you have said in some way, shape, or another is like the campus has a strategic plan, right? Like, and everyone to an extent kind of thinks to how their work is going to ladder up to that work then. And I think, to get that buy-in, it's really like tying it back into like, my goal is actually pretty similar to your goal too, and here's why. I love that strategy. I think that's really helpful and can help people kind of just speak the same language in a way. So diving a little bit deeper, Phyllis, I know you mentioned the campus marketing a little bit earlier on in the presentation. We know that there's often a fear for like whether these programs are actually going to yield utilization and then of course lead to ROI. So how do you think about optimizing engagement on your campus for both students as well as faculty, and how has that worked for you overall?
Well, again, there's optimizing engagement, I think, goes hand in hand with the number of different opportunities that Mantra provides for students to be able to access these resources. So they can access the self-care, they can access the clinical care, they can access the care with peers, they can access the DBT modules. So it's optimized in a number of ways because of the variety of services that can be provided and the number of different options that are provided through Mantra. I'm not sure if that answers the question that you're.
Yeah, I think that's one way to show that, we get utilization because there's something there for someone, is kind of what you're saying.
Mm-hmm. Yes.
Yeah.
Yeah.
Definitely.
So I'll jump in if I can just add a little bit more. So again, some of the components that I've strongly appreciated from Mantra is the idea of campaigns, right? And so, well, yes, you can send out an email blast to every single student, and that has certainly shown some dividends for us, but we've also been working on social media that Mantra has created for us, digital marketing, which may not be working for our specific campus because that QR code didn't yield much, but we just did that as well. But you get a lot of guidance from Mantra in terms of those campaigns. And we also can get a breakdown of users. So I can certainly say, here are all the NJIT email addresses of students who logged in. I don't know what service they were using or what they were discussing, but I can at least go to the tech office and say, can you give me a breakdown of these students? How many are undergrad? How many are grad? How many are domestic? How many are international? Plus Mantra also, there are some components where a student can self-identify. So if we are, say, for example, we know that our LGBTQIA plus community is not utilizing this to its greatest extent, then that provides us some great opportunities to go to the student organization, the advisor for that group, some of those major touch points where those students might be connected to remind them of this. We have now that we've done spring, and so Kelly, Dr. Bully and I just met to talk about our spring plans. And we had a great conversation about what would be some activities we can do this spring semester that will continue to increase exposure to this. So some of those things are going to be, again, the campaigns, which Mantra will give you an email that says, here's the subject, here's the body, edit as you see fit. And they also do that for faculty and staff, because one is faculty staff, one is student facing. They provide images. Even for social media, they provide the accompanying social media post with the copy that you could put in there and edit. But that's been helpful. So we'll send that out again. But we're also going to do more information sessions. So in the fall semester, we put out, I think, 4 info sessions, 2 for faculty and staff, 2 for students, in which they can come on virtually, learn about the platform, ask questions. We'll do that again. And then I think we're also going to be working on some targeted campaigns for spring recess is coming. Mental health doesn't take a break. And so you could still access these services, or preparing for final exams, and what could be some resources as part of Mantra that could specifically help students prepare and deal with some of their stress or anxiety with that. And then, of course, as summer comes, a lot of students might think, okay, it's summer, there's no more counseling opportunities for me. And that's the furthest from the honesty. So we can also set out a targeted campaign to say, wherever you are in the United States during the summertime, you can still utilize these services. So it just takes some time just to reflect on what isn't working or what worked and what needs to be bolstered. But again, you don't do that alone. You do that with Mantra, and you kind of have those processing sessions. So it's been very helpful for us.
Yeah. Another way, sort of a smaller way, I guess, of optimizing care sometimes for us may just be that if where there is a small wait before a student is able to have a meeting with someone in CCAPS, if they're looking for an in-person, then they can turn to Mantra, to the modules, to the self-care modules, to the on-demand services, to the coaching services. So there's a number of different services they can turn to in the interim. Sometimes, and as Sean mentioned, to have the care no matter where they are, and have that ability, because Mantra does have clinicians who are licensed in other states, who are able to see the students during the summer if they're away. So that's another way it can be optimized.
I love that anecdote, Phyllis, because it goes back to what you were talking about earlier in terms of you were looking for a vendor that could seamlessly integrate. And I think that's a really wonderful way to show like the complementary way in which we can support your on the ground clinicians. So, student comes in, they want in-person care. A lot of them do, and that's fine. But with what this enables you to do is, let the student, if there happens to be a wait time for in-person care, you can offer them Mantra to kind of hold them over until they can see that person in person. So that's what you're talking about.
Yeah, and it can also, for in between sessions, students can
Right.
go and use the modules and use the self-care to kind of just bolster what they're doing in between sessions, even if they're working with someone on campus.
Right.
So it's another way it can be optimized.
Okay. Great anecdotes. Just to wrap up this implementation part of the conversation, what challenge do you think people should be mindful of when, whenever you look back on how you manage the implementation and things that you maybe wish you could have done a little bit differently, with hindsight being 2020? What are those things that you would do differently next time if you could?
I would say just the earlier rollout.
Yep, agreed.
Granted, I believe that students and families are overwhelmed and oversaturated with information at the start point of any student's college career. But I find that currently faculty or parents, families, and students are very much looking for this information. And so it's nice to be able to say, now here's all these things. And I'm actually looking forward to orientation processes and times next year, summer retreats, working with faculty staff, because we can really hit this at a time in which they seem to be more amenable to discussing these things and asking more questions, as opposed to how busy it could be sometimes during the semester. But we're still doing it, and we've had some great success. But I would just say timing.
Yeah. And for folks on the call, just in relation to how our partnership, contracting just took a little bit longer, and we launched mid-semester in October. So obviously that's past this like orientation point that Sean's talking about, that is really pivotal when care-seeking behavior is often at its highest. Anyone else have anything to add?
No, I agree with Sean. That's the biggest, not challenge, but that's the biggest advice, is that it's the timing of the rollout.
Timing is everything.
Yep.
Okay, so forward thinking, how do you continue to fund this thing? I know that's always the question that people have. ROI and sustainability is the name of the game. So how do you think about finding future funding sources for these types of programs? And maybe I'll kick that to you first, Mary Beth.
I don't know why. My colleagues always look to me for money. I don't know. But no, in all seriousness, it's crucial to explore like as many diverse funding sources as possible. And the way I'm thinking about this is that, you know, we're going to start looking at grants again. You know, looking at some different partnerships with maybe some healthcare organizations, looking at our alumni and our donors, because everyone's invested in mental health, but it does need to be funded. But the key is, in order to get that funding, in order to secure that funding, is that we have to continue to demonstrate the positive impact that Mantra and other programs are having on our student well-being and on their academic performance. Because that's what's going to attract that fund, in my opinion, that's what's going to attract that funding from, in particular, alumni and philanthropists, and hopefully some future government initiatives. We can show that this has been successful and hopefully secure that funding. But that's always the question, is where it's coming from, but start thinking about it early. That's the key.
Yeah, sometimes like it feels too early, but like it actually is necessary. These things take so much time.
It's never too early, and you know, yeah, it's never too early.
Yeah, and I mean, and that's why when we were talking earlier, really Sean said like thinking about ROI during implementation so that we can build that foundation so that whenever we do need to do that, we're ready.
Mhm.
Yeah. Speaking of that, you know, that ROI piece, how do you think about, you know, tying Mantra's outcomes that you've seen in the program so far to your strategic plan to improve student well-being? Like kind of going back to what we're here to talk about in general, which is achieving student success. How do you think about how the partnership so far has helped your campus achieve that?
Well, I think that first and foremost, you know, NJIT has a commitment to really addressing campus health matters, you know, across the board. So that's a critical part of our strategic plan, right? So the key also is to keep this topic in front of our board of trustees and our donors and our alumni. So I co-chair the committee on student experience on the committee on campus experience, student campus experience. And one of the topics that we talk about at least once a year, key to the committee, is about the health and wellness of our students. So it's keeping this issue in front of our board. But now we have a little more information, is that we've introduced over the last year telehealth to the campus through Mantra, and now we can share some of this data. So we continue to share this data. We continue to build that commitment to our campus health initiatives, or campus health and wellness initiatives.
Yeah. And just one point to add on to that. So our 2030 plan that's currently in discussion as of right now has, I would imagine most people's has this as well, but it has a direct line that talks about expanded services for students under counseling as well as physical health. And so even in our check-in meeting that Dr. Bowling, Kelly, and I had just the other day, the number of students who are using the service, especially therapy, Kelly had acknowledged is almost equivalent to a full-time clinician in the number of people that they see. So to be able to say we can demonstrate the volume of students who are using this is certainly tied in directly with what the strategic plan talks about, is expanding services. And this is doing that. And it has shown dividends in terms of how many students are using it, almost to the equivalent of a full-time counselor within a year of seeing students.
Yeah.
And
And the
that's critical.
outcomes are positive as well. So we've seen some outcomes with improvements in students reporting of decreases in anxiety and depression, and sort of there's self-development just in general. We've seen some results already, even though we haven't been working that long together.
Okay. Anything else to add on this piece, or any last takeaways for your colleagues here on the call?
It's a great team, very, very helpful. I can email Kelly at 9 a.m., 9:15, I get something back from Kelly. And or team, if I email Julianne for some social media stuff, it's almost like an instant. It's not that I expect it that fast, but it's always a lovely benefit when that does happen.
Yeah, very responsive team, very, very responsive. And
Thank
really trying to listen to our concerns and address our concerns as, to the best possible.
Yep,
What
and
we're here to do.
we appreciate the impact you all are making on our campus right now.
Right. Well, thank you all so much for the discussion. For those of you still on the call, I actually don't see many Q&A questions that have come through. Does anyone want? Oh, here we go. You mentioned supporting your students in mental health and physical health. Can you share how you incorporate physical health within the partnership at Mantra? So we do only focus on services that are related to mental health. We don't have any like direct physical health support services, but I think when you're thinking about the holistic, the way to address mental health holistically, it really does take into account those, making sure they're exercising, making sure they're eating properly. Like that is all incorporated into how we deliver care naturally, because that's our approach to care and just how we, how our therapists frame their sessions and the things that they bring in and the goals that they create with students. And also within the way that we build our content, it's also taking that frame of mind. But just to be clear, we do not have direct physical health support.
Kelly, question, if in terms of the coaching, so I understand coaching is wellness, is mental health related. If a student wanted to set goals towards better physical health, would that be something that the Mantra coach would help support or help with goal setting?
Oh, definitely. Yeah, exactly. So like whenever both the coaching and with the therapist, like when they're thinking about what their goals are, both of these service lines are goal oriented by nature. That's kind of how we deliver our care. And it's just, for the lower acuity folks, they go to the coach. For those a little bit higher acuity, they'll, route to the therapist. But both are really focused on making sure that like they set goals together and that those people, they help the student then reach those goals. That's what the sessions are all about, and really taking that kind of like behavioral approach. Yeah. Can you tell me a little about the self-care program? Sure. So actually, maybe you could go back to that slide, Haley. That would be really helpful. Haley. Okay. Thank you. In the meantime, I'll answer this other question. Have there been Mantra modules that have been used by your undergraduates more than others? So I think that's for you all. So by that, do you mean like undergraduates instead of graduates?
I took that to mean, are there particular modules that have been used?
I took that to mean
Okay.
the modules that are most often used.
I leave that to Dr. Bowling and Sean to.
Got it. I can answer that one.
Yeah.
So yeah, our modules, and maybe, okay, so now that we have this here, I can say more about what self-care is and then what the frequency of our modules. So self-care is what you can see all the way on the left side of the spectrum. And like I mentioned earlier, this model is really meant to be comprehensive in a way that it addresses students on the level of acuity or the level of need that they have and really meeting them where they're at. So the left side is that health promotion side, where the aim is to really help the student develop life skills and resilience. And our self-care program is these short self-guided wellness courses that are grounded in DBT or dialectical behavioral therapy skills, and they're really meant to promote positive mental health and well-being. So it's really meant to kind of like give the students the skills that they need to function better in their day-to-day. They may not, get to the point where they need coaching or need therapy. And these types of more health promotion models help keep those symptoms at bay so that it doesn't escalate to the point where they really do need the more clinical services. Modules that have been used by undergraduates more than others. Just to confirm, I think you're talking about the self-care modules and like the types of topics that are in there. But we've really built this, and it's built by someone on our team. Her name's Dr. Carla Chugani, who is a national expert in doing this type of work. She was at the University of Pittsburgh before joining us at Mantra. She's amazing. And she built this work to really focus on the student experience. So it's very applicable to the types of things that, you know, this population may need support on. So things like making new friends, that's particularly important for our freshmen, those first years that we know we're always trying to target to help catch them when they might need the services the most. Other things like we have a thing that's called, or a module that's called Stop Freaking Out. And that's really meant to kind of have this distress tolerance aspect. So, you know, whenever things get really crazy and like the semester feels very overwhelming, it's kind of meant to just help them through that and get to the other side so that they can still focus on their studies, still focus on what it is that they have to do, despite, you know, these heightened emotions that they may be experiencing. Hopefully that answers your question. Let me know if I didn't. Yes, I see some people raise their hands, so feel free to unmute yourself if you want to, if you have a question and you want to say it out loud, or you can put it in the chat if you haven't already. Okay. Any more questions from the group? Okay. Oh, thank you very much. So this says, not a question, but this has been very helpful and inspiring. Thank you. So that's a testament to you all here on the call. Thank you so much for taking the time. I always enjoy talking with you through all these nitty-gritty things about how to make these programs come to life. So appreciate you as partners and appreciate you coming here today and sharing your experience. So thank you so much. And thank you for everyone coming. Just to actually wrap up a few things. Yeah, just the post-event survey. So just a reminder, whenever you close out the Zoom, there will be a pop-up survey that comes up. So if there's anything you want to share, or if you want someone from Mantra to contact you, feel free to fill that out. And then we will also be sending the recording just as a reminder there. So you can keep an eye out for that in your inbox. Okay, well, thank you everyone, and hope you have a good rest of your day.
Thank you.
Thank you, everyone.